Good morning, everyone. We will start our program very shortly. Welcome everyone to the today's program. However, we will urge everyone to stay mute to avoid background noises that may disrupt you from listening to the webinar. Throughout the webinar, we will be managing the chat function, and if any questions, any queries, you can type on the chat box throughout the presentation. And please stay on mute to avoid any noises. Thank you.
Request ED NIDM for his inaugural address.
So, can you hear me, Dr. Harjeet?
Yes, sir. Yes, sir. Yes, sir.
Okay. First of all, good morning to everyone, and thank you, Abhisha. Your voice was not very clear due to some connectivity issue, but I could get the gist of it. I first congratulate and wish Dr. P. Wilson, who's the principal and secretary of the Madras Christian College, for collaborating with NIDM and organizing the webinar on such an important topic. And I also welcome Dr. Mariam Samuel, Dr. SP, Dr. Sudarshan, and Dr. Professor Surya Prakash, along with the three YPs, that is Dr. Harjeet Kaur, Mr. Raju Thapa, and Mr. Anil. It's a great privilege to be taking part in this particular webinar, which is talking on a very unique topic, crisis and disaster management. Crisis, as it is part of a disaster management, and it cannot be said crisis and disaster management. It can be, I think, more like crisis in disaster management, because what happens is in every day, whenever a disaster is about to strike, you have this feeling of panic, you have this fear of the unknown, you have anxiety, you have stress of the impending disaster and what will be its effects. So that itself gives rise to a crisis-like situation, which is in the mind, first of all. And thereafter, when the disaster strikes, then it amounts to action taken to remove all these mental anxiety levels that has caused the anxiety, raised the anxiety of the mind, as well as physical deficiencies or inadequacies that have arisen out of the whole issue. I can hear myself. Is there an echo in the system?
No, sir.
No, you're hearing me?
Everything is fine, sir. You can continue.
Okay. This particular webinar has covered very beautifully the role of various stakeholders, that is the health services, the youth, the social services, the rescue services, the media, the relief and rehab in crisis management, the various concepts in that, and effects of crisis and disasters on various vulnerable groups. So this particular webinar will be converting theory into practical knowledge. How do we convert the theory into practice? Because many times we have seen that people are not mentally prepared for the calamity that is about to befall them, and they're not mentally prepared, and hence once they're not mentally prepared, they are not able to take the correct and rational decision in a timely and proactive manner. So there is a need that proactive intervention has to be there, and all people who are playing whatever part or going to play whatever part in a crisis like situation, in a disaster scenario, here we are talking only of disaster scenario, should have the knowledge of what that person is required to do, and should have war gamed it or done a tabletop exercise and done some field exercise, done some mock drills within their organization, within their setup, to put that theory into practice and done the tying up. More often than not, we see that the maximum crisis management is done at the community level. And the preparation of the community to deal with crisis and disaster management is the top priority, has to be the top priority, because before the first responders, established first responders arrive, that is the NDRF, SDRF, and other government functionaries, it is the community which looks after its own. In each and every disaster, you name it, from historical times to the present day, even the one which Vishakhapatnam gas leak, we saw how before the teams reached, the civilians, the locals around the factory, they evacuated people on their bikes, on their scooters and cars, auto rickshaws to the nearest hospital. Now, they didn't know what is happening. They just found someone in need and took them to the nearest hospital. So if such training can be given to these community people, it will go a long way to save large number of lives. Crisis management is not only saving lives, it goes much beyond that. It goes into the whole life cycle of settling them back. But that is somewhere gets mingled with disaster management. Today, I'm not talking too much about the crisis during disasters, because we have the person who's dealing with this day in, day out, who's breathing this issue day in, day out, that is the DG NDRF, Shri S.N. Pradhanji, who will be able to throw so much insight into this whole issue about crisis and disaster management in real sense as to what happens on ground and what are the ways and means when it can be made better. That I don't want to, I am not talking about that intentionally, because I am also keen to listen to his special address, and we are so thankful to DG NDRF for joining this particular webinar to address especially on a core issue, which is his stronghold. With this, I once again thank everyone, and I would like to also inform you, since many colleges and institutions are involved in this whole program, the number has already crossed 700, 800, and people are represented in various universities and institutes, that NIDM has established an India University and Institute Network for Disaster Risk Reduction. It's a virtual university. Sanction has been given by the Government of India. The website is there on the NIDM webpage, and it's a free registration to be a member of that particular this network of universities. I'll request all institutions and universities and everyone who is interested in doing something to register into that. We'll be rolling out a plan in some time or so, and it's a free registration. It will be a home to many things which are going to come in future. With this, once again, I thank Mr. Dr. Wilson for collaborating with NIDM, and I am keen to listen to Dr. Shri Pradhanji, and thereafter to the balance of the sessions that will be continuing for next 3 days. Thank you, and over to you, Abhisha.
I think she has some problem.
Okay.
But thank you very much, sir, for your keynote address, and you highlighted we are exceeding our time. So now I request DG NDRF Shri S.N. Pradhan for his special address. Over to you, sir.
Okay, so good morning, everyone, and all the distinguished panelists and all the senior officials and the academic community. I'm very, very happy that more and more there is a focus on disaster management, and there is more and more focus on disaster response. Since there are my interface with you today will be in I think I'll just make the initial point about disaster readiness as a culture. In my special address, I'll talk about NDRF and how NDRF is part of disaster readiness, or has become a part of that disaster readiness, at least for India. But let me just focus for the time being on in this keynote on the the aspect of disaster readiness as a culture. One of the more critical aspects of the development index of any country is its disaster readiness. And I have always advocated that it's a governance issue. It's a mainstream governance issue. Now, this is a social work related department, and because when you talk about disaster readiness of a country, it is, of course, a governance issue, but it's also a community issue. And that is why the most ready, disaster ready countries of the world are where not only the government is ready, but the community is ready to tackle a disaster. That is the bottom line, that the community is as ready as the government, and they are in partnership to fight a disaster. Let me give you an example in the time of COVID. How many of us are hearing about Japan and South Korea, for example, in the context of COVID pandemic? Initially, we did hear about South Korea. Initially, we did hear about Japan. But where are their names in the lists of affected countries or countries going wrong in the wrong direction? Because they have always had a disaster ready culture. When I say a culture, there is a very famous saying of Peter Drucker that culture can eat strategy for breakfast. You can have all the strategies on paper, you can have all the policies on paper, but if you do not have a embedded culture, both at the governance level, at the policy level, and at all levels of governance, at the federal, at the state, at the local, at the sub-local level, and also at the community level, where every community citizen is not only prepared, but empowered, feels empowered, and also feels capable of doing the basic handling of a disaster situation when it happens. So this is something that is a non-negotiable in terms of, if you ask me as DG NDRF, I'm the happiest to respond in places where we find that there is an all hands on the deck approach. We are very happy when we are operating in Orissa, for example, because we realize we are an equal partner in many partners. The state government is an equal partner. The state disaster response force is an equal partner. The state disaster response department is an equal partner. And most of all, the community is an equal partner. The volunteers of the community are hand in hand, going on hand in hand with the NDRF, wherever the NDRF goes. So you realize that everybody is on the deck, everybody is invested in responding to the disaster. So this is the culture of disaster response. And it is not an exception. There is a very interesting saying that the least probable incident or event or the least probable disaster is probably going to happen around the corner. The least probable disaster is most probable. Should be enshrined in golden letters. The least probable disaster is most golden letters. And since we are now interfacing with the Department of Social Work, it could not be more appropriate, I said. In the sphere of social work, disaster readiness as a social work principle, as a social work readiness principle, cannot be overstated. So it is very important that, when we train the NYKs, the Nehru Yuva Kendra volunteers, we have trained about 10,000 of them as NDRF friends. You can give any name. You can give Abda Mitra, NDRF friend, whatever you call. But they are essentially social workers coming out of the society, and they believe that disaster response is their not only right, but a duty towards the society, that they should be able to guide others. And I never tire again of this example, that in Cyclone Phony in Orissa in 2019, which was an extremely severe cyclone, there was a lot of talk around the world that more than 1 million people were evacuated within 48 hours. Major credit for that does not go to NDRF or the SDRF or the ODRAF, that is, but to the 30,000 red cap wearing volunteers across Orissa coastal districts who propelled, who cajoled, who persuaded everybody in the affected areas to move to safety. And that made the work of government agencies that much easier. So it is the culture of disaster preparedness and the culture of disaster response. And to end, I'll just wrap it up by talking about Japan and South Korea in the context of COVID-19. One of the preparedness principles is enculturation, acculturation, or embedding the culture. We all know that in the Far East, especially in Japan and South Korea, anybody who has even the suspicion of some kind of a fever or an influenza or some kind of a respiratory problem, he or she will wear a mask. Even a child wears a mask. They have been doing that as part of their culture. So this is nothing new for them. All through. But there was a differentiator. When you have a culture and you match the culture with technology, and this is the differentiator, they brought in the best technology of tracing, testing, and treating. So culture with technology, which technology also becomes part of culture. Tracing, testing, treating. This combination is near invincible. You cannot be invincible in the face of a disaster or a pandemic. But when you combine great technology with great culture, embedded culture of disaster readiness, you can be near invincible in the face of a disaster. Because as they say, there is nothing called a natural disaster. There is nothing called a natural disaster. We all know that we categorize disasters as natural and man-made, anthropomorphic, etc., etc. But then deep down, if you look at it, every disaster has some man-made component. And with climate change as an issue, or climate crisis as an issue, we all know how much of it is anthropomorphic. That again is a cultural issue. The kind of damage that we are doing to the environment is because of our cultural practices or the practices that we have internalized now as part of, whatever carbon emission we are doing or whatever we are doing has been brought into our culture almost, our habits. And these habits are forming our temporary kind of a culture. We have to come out of that grid and have a culture of protecting the environment. And that is when things will start to change. When you don't listen to nature, nature pulls your ear and makes you listen to it. This is what has happened in the COVID crisis. We were not listening to nature. Now nature pulled our ears and made us listen, is making us listen. And it is a very costly way of listening. At the end of the day, if you don't learn it yourself, you cannot be made to learn, or it will be difficult process of making you learn. I think this is the signal lesson. So disaster readiness is not rocket science. Disaster readiness is not a great philosophy. Disaster readiness is just very simple common sense. And common sense, as we all know, is very uncommon. And that is the lesson we are learning through this COVID crisis and through all other disasters. So when I gave a special address about disaster readiness and some of the aspects of disaster readiness, I'll cover in detail. But for now, I think these are the ideas I would like to leave with you, and then we'll take it from there. Thank you and Jai Hind.
Thank you, sir, for beautifully narrating the entire series by saying culture of disaster preparedness. We really happy to hear the word, the phrase, the culture. I think we need to nurture the culture of disaster preparedness. Thank you for that. And participants, Sir will also be presenting a special address at the end of this day at around 11:30. I'm sure he'll bring in more details to it and bring in the quintessence of disaster preparedness. And now we move on to the next speaker. We invite Dr. P. Wilson, the Principal and Secretary of the Madras Christian College. And Dr. P. Wilson is also an erudite scholar, a postdoctoral fellow from Israel, and he has taken over as a principal and secretary from June 2020. So we are would like you to be a felicitation conference. Dr. If Dr. Wilson is not here, we will move on to the next speaker, and probably we will get him online in a few minutes. May I ask Professor Dr. Surya Prakash, Head Geometeorological Risk Management Disaster, GMRD from NIDM, to do the felicitation for this training program.
Am I audible?
Now, Dr. Surya Prakash.
Yeah.
Yes.
Am I audible, Dr. Prince?
Yes, sir.
Okay,
Yes,
thank you for
yes,
this
sir.
opportunity and for collaborating with us in organizing this particular webinar for 3 days. That is 3 days online training with the Department of Sociology, because communities are actually the key holders. As Shri S.N. Pradhanji said, that response agencies can do their work, but until and unless the communities are not involved or our social organizations are not involved, we cannot do justice with preparedness and response. So crisis management actually, as Major General Bindal also said, arises from uncertainties. The things are unknown to us, and the improbabilities that we are not sure when it is likely to strike and where and who can get affected. So these are actually parameters which bring panic amongst us, because things which suddenly befall upon us and are not expected actually cause more damage than expected, right? So therefore, there are two parts of this crisis and disaster management. One is pre-disaster management, where we will try to assess, evaluate, and identify the parameters that will affect the occurrence of a disaster and its consequences, right? The second part is that we will first try to avoid, prevent, or mitigate those risks which can arise from crisis or disaster situations. But still, nature is much mightier than the man. So therefore, we'll always have some remnant risks, and those remnant risks have to be met through preparedness and response. So what kind of preparedness is actually required? It's not only physical resources, but also the human resources. The mental preparedness is much more important than the physical resources. So therefore, each one of us amongst the society should know the likelihood of any kind of disasters and what is to be done against them in order to tame them, in order to reduce their impacts. So that is basically the things that we would like to teach through this program. The other part which is important and highlighted by our distinguished guest in his special address, S.N. Pradhan, is development of a culture And this is our part of national policy on disaster management, that it's not just establishing activities, but building a culture of prevention and preparedness against disasters or quick response against disasters. So this will be possible only through educational institutes like yours and other institutes which are becoming part of this program. We are expecting that the culture is developed through educational institutes, because that's the time when the youth tries to learn, and you can be molded to adapt to natural lifestyles in harmony with the nature. What is happening that most of us go for against the nature's principles and do injustice, and then the vagaries and furies of nature fall upon us. So therefore, we must learn that what is acceptable, what is good, and what are those best practices, and what should not be done. Both are equally important. What should be done and what should not be done. So we should try to learn from this. And in case something mishappens in terms of catastrophes, accidents, or disasters, or crisis, then how should we handle it? There is a term. Disaster actually comes from two words called des and aster, which is a mythological concept. Means a bad star appears in the des means bad, aster means star. A bad star appears in sky and the misfortunes happen. But I would use it. A star word you should use actually in response also, which means S for stop. If something is going wrong, so don't just have a reflex action, just try to assess. Stop, think, act, and respond. So you should actually look around, assess the situation, and then only respond rather than any reflex action. That is where our preparedness counts. So we are going for mock drills. We are going to educate people to develop culture of prevention and preparedness. And we are also going to provide resources and trainings to the people so that they can become self-reliant. Atmanirbhar is the now slogan of the day, not only in terms of livelihood and economy, but also disaster management. Because it's the communities who are the first responders, who are also the victims, right? So therefore, if our communities through sociological departments and approaches can be strengthened for disaster resilience, and then we can achieve the goal of a disaster-free nation, or with risk reduced and resilience amongst our communities. With these words, I thank for this opportunity for the felicitation address. Thank you.
Thank you, sir. Thank you, Professor Dr. Surya Prakash, for highlighting the importance of mental preparedness as we prepare for the physical preparedness for any disaster. I think mental preparedness and community resilience building, I think these are the two highlights that you have pointed out during your felicitation. It's such an important thing. In the coming next 2 days and today, as we deliberate this issue, we will be talking about it as a vital point. Now, I think Dr. Wilson, the principal and secretary of Madras Christian College, which is also a joint host of this program, this international training program on crisis and disaster management, is with us. And now I request Dr. P. Wilson to address the gathering.
Am I audible?
Yes, sir.
Yeah. Good of you. It's a privilege for me to be here in felicitating the International Training Program on Crisis and Disaster Management. First of all, I would like to congratulate the Department of Social Work, the head of the department, Dr. Miriam Samuel, and the efforts by Dr. Sudarshan and the other professors in conducting this particular program successfully. I would like to recognize the presence of Major General Manoj Kumar Bindal. I've been listening to him. Sir, thank you for your presence, and I would like to also recognize the presence of Shri S.N. Pradhan, the DG of NDRF, and I was also listening to Professor Dr. Surya Prakash, the head of Geometeorological Risk Management Disaster, And I thank you for your presence and felicitations that was provided to us. And congratulate the department once again, because it is not only deliberating on this particular content intellectually, but also I have been with the department from the first week of June, and I could see or witness their work among the migrant laborers in the relief programs in association with our college. And I would like to just provide a thought and just wind up my felicitation. Everyone presented this disaster management, their own perspectives. I would like to give one philosophy and just wind up. I consider this as disaster management as kind of a conservation of a dignity of human race amidst crisis. I repeat, I consider this as a conservation of dignity of human race amidst crisis. I think our college is really doing wonderfully, and especially the Department of Social Work of the aided stream is working towards that. And one thing that I appreciated is in collaboration with NIDS, NDRF, and NIDM, it's something that needs to be appreciated. So I want to be very brief in my felicitation. Thank you very much for giving me an opportunity. Thank you once again.
Thank you, sir, for your kind words and short and sweet felicitation. Now we move on to the final remarks and a word of thanks by Dr. Miriam Samuel, the Head Department of Social Work, Madras Christian College. Now, Dr. Miriam Samuel.
Thank you, Prince. I hope you can all hear me.
Yes, yes, ma'am.
Thank you.
Yes, ma'am.
Good morning, everybody, and I'm very happy to be part of this webinar that has been organized by us jointly with NIDM. I know it's a very unfortunate situation that in which we are all meeting at a time when the entire world is struggling to deal with this pandemic. And we remember at this time the sacrifices that are being made by all the frontline warriors, very especially our governments all over the country, starting from the Prime Minister's office, government offices, non-governmental organizations, volunteers, and others who have been working around the clock to deal with this disaster. And I salute all these warriors at this point of time. The Department of Social Work, being an academic institution, thought that it is imperative that we equip ourselves to deal with disasters such as this. We all are more frequent now. Even just after we started 2020, we have witnessed a number of disasters in the last 6 months. And I think what is very important that as professionals, as practitioners, as volunteers, as people who are concerned in this particular field, it is very important that we do not have a reactive response, but rather develop a proactive strategy. I was very happy to hear Professor Dr. Surya Prakash use the word resilience. And I think it's so very important that India as a community builds resilience among. We've seen the unfortunate incidences with the migrant workers, the poor, women and children, and many outcomes of the disasters in terms of abuse and rape, unemployment, suicides, and mental health crisis that is taking place in the country today. And therefore, in a situation like this, it is not enough for us to react just in terms of providing relief and other measures, but it is very important that we are proactive, building the resilience of people so that we do not see unfortunate situations that we're seeing right now. I know that more than 900 people are participating in this conference, and I do hope that this particular training program and webinar that we are having will be an eye-opener to all the professionals from different walks of life. We made an analysis of the people who had registered yesterday. So we have students, we have professors from all over India and abroad. We have non-governmental organization representatives, we have government officials, we have volunteers and interested citizens in this webinar. And therefore, I'm sure that this webinar will be an opportunity for all of us to connect, to share our experiences, and to learn from this particular webinar. I do understand that this is very new to all of us. We're connecting virtually. I apologize for some of the hiccups that were there, but we do hope that we will be able to set all this right and the sessions will go on smoothly. I think it's my responsibility to also thank very much NIDM for agreeing to collaborate with us, for believing in us, and to believe that we can deliver at the end of the day. And a very, very special thank to Major General Manoj Kumar Bindal and Shri S.N. Pradhan for your presence here. We do know how busy you are with so many ministerial meetings, but we thank you so much for the time that you gave us. Thank you also, Professor Dr. Surya Prakash, for your words. And a very, very special thanks to my own dear principal, Dr. Wilson, who's just taken over from June 1st and has been very, very supportive of all our initiatives. I think this is one of the major events that he's having after he took over. And thank you very much for your warm words to us. Thank you all very much. And we do hope. I also should thank all the resource persons who have come, who have agreed to share their experiences with us and come virtually to connect with us. And we really look forward to hearing each of them share their experiences. So thank you very much. And I request all the participants to stay on and to continue participating over the next 3 days. Thank you all very much, and God bless you all.
Okay. Thank you, Dr. Miriam. Now, as for the conference participants, we would like to quickly give you some updates so that we are aware of this training program. This is an international training program on crisis and disaster management, and this program is scheduled for the 9th, 10th, and the 11th of July. So every day from 10 o'clock IST to 12 o'clock IST, we will be presenting. All the resource persons will be speaking during this time, and the certificates will be given at the end of the 3-day conference, 3-day training program, and we require 80% of your attendance in the sessions. That will help us to, consolidate and give a participation certificate. And also, if you have any questions, we have arranged Q&A sessions in between as per the program schedule that you see. So we would request you to kindly use the chat box and type in your questions. Even if you have questions on the go, please type in the questions. There will be a team is working on collecting these questions, and then we'll be posting it to the speaker at the end of the session. So now we move on to the next session, the inauguration. After the inauguration, we have the speaker number 1, Dr. Chaozing Huang. And now Dr. Chaozing Huang is going to speak to us from Taiwan. He's the director for Center for Social Empowerment in Changjiang Christian University. He's also the director for International Jane Goodall's Roots and Shoots Eco Center in Changjiang Christian University. He's also an assistant professor of the applied philosophy from CJCU. Dr. Chaozing Huang, to know about him, you need to know a little bit of the background of the experience. He has 3 decades of experience in working with disaster and involving in the community, like how we heard in the felicitation that he is involved in building the communities to prepare for disasters. And he is not only a community development worker, but he also works in the university. So he involves the student communities to play an important role in building these communities. So he is closely in the community in Taiwan. Today, he is going to present about the role of youth in disaster management. From his vast in directly working in different disasters in Taiwan. Sir, we would like to welcome you for this training program, and we look forward to your presentation on the role of youth in disaster management. Now, Dr. Chaozing Huang. Dr. Chowsing, you can start.
Dr. Wang, kindly unmute yourself. You are on mute. Hello, Dr. Wang. Hello.
Dr. Chowsing, can you unmute yourself?
Okay, Dr. Wang, I am unmuting you from my end. Okay. Now you can speak. I have unmuted you. Dr. Wang, you can speak now. You have been unmuted. We are unable to hear you, sir.
He's still not unmuted.
I'm unmuting him, but I don't know. Maybe because of some problem,
It's
it's getting muted again.
Yes, it's in red still.
I think we can, otherwise we can continue with our session for the next presenter. Till then, we will try to contact him.
Yeah, we'll try to contact him.
Yes, sir. Yes, sir. We can move to Dr. Surab Dalal from National Professional Officer for Emergency from World Health Organization. Sir, we would like you to come and do the presentation on the role of healthcare sector in disaster management.
Am I audible?
Yes, sir. Yes, sir.
Okay. Good morning to everyone. First of all, thanks for the invite, and I have been associated with the entire disaster management system for 9 years now, working with National Institute of Disaster Management, National Disaster Management Authority, and now with the World Health Organization. So it's a coming back home experience for me. So my presentation will be on role of health sector in disaster preparedness. So I would like to share my presentation. Is my presentation visible?
Showing, sir, you are sharing content, but it's not visible yet.
No.
Yes, sir. Yes, sir. Now we can see.
Okay. So, first of all, welcome to all the participants. And as mentioned, that the participant today is from very sector groups. So it's always a very good experience when you talk with people who are from academia, from management, from the administration, from the field as well, and also the community and the general population, because this is particularly one of the subject earlier neglected, but nowadays no one can do anything without the taking risk perception into consideration for day-to-day life. So what are the changes we as a society is seeing in this particular arena of disaster management? Let me start with an anecdote. if this would have been an international training session, say for example 3, 5 or 7 years before, the role of health sector in disaster management session would be probably coming somewhere in between or in the end. And even if you find out the speaker, probably the audience would not be much more interested. And but unfortunately or fortunately, this subject has been able to come into highlight. And currently, each and every one of us is seeing the impact of what level of pandemic we are facing and going through. So everyone, when you step outside your house, you are seeing people wearing masks every day. This was not us, at least a few months back. We have been seeing traditional amount of outbreaks, pandemics, and epidemics across the world, but of this magnitude, which can damage the entire world, affecting 216 countries, socially, economically, and moreover than before, highlighting the issues of leadership, political governance, the issues of risk management, and other topics related to disaster management have become the prime focus. Even in this pandemic, when we started, the Disaster Management Act was instated, and then the executive powers were given to the Ministry of Health and Family Welfare. So this was the time when we started referring to our books, and what we found was we had the guideline on biological preparedness, which was released by NIDM, and based on that, all districts and states of the country were supposed to have a epidemic or a biological preparedness plan. But actually, when we were in the pandemic, we started realizing that many of the states are not having those things ready, almost more than 90% of them. So we then referred to the books, which we have not seen in past 10 years. So the reason was there was a lot of neglect in this particular area. And the thing is, it was taken but obvious. If it's an issue related to earthquake engineering, it would be simply easy for even us, I'm including even myself, as a disaster management professor, it would be very much easy for me to give it the subject to the any person who is associated with IIT and is working on earthquake risk reduction, neglecting the impact side as well. So what is the social impact of earthquake? What is the health impact of earthquake? Probably this would not be addressed better by persons who are engineers or structural engineers. So we need a multi-sectoral approach in this particular concept. Similarly, it was believed till now that health is and medical is only dealt by doctors, but we here fail to understand. I'm very I've seen this field, and I can say with my experience that people hardly know a difference
Excuse
between a
me, sir.
psychologist. Yes.
Sir, your voice is breaking and it is not comprehensible. So can you do something about it?
Yeah. I'll try to reconnect.
Yeah, I'm sorry to interrupt you, but your voice is not clear.
Yeah. Is it better now?
Yes, sir.
Okay. So a lot of us don't know the difference between psychiatrist and psychologist. And we believe that the doctors and nurses who are practicing medicine in the hospitals will take care of the even disaster management perspective when it comes to the health sector, which is not the case. So let me introduce you first with a few concepts of, there are many misconceptions in this particular sector when we talk about disaster healthcare and disaster medicine. So this is an emerging field around, say, around 17 or 20 years old. Primarily started with disaster management, but now is being practiced as a different specialty, and probably it covers around 30% of the weightage of the areas which are covered in overall disaster management. So the aim of this particular area is to do the greatest possible good to the largest number of people affected within a very shortest amount of time. And traditionally, what has been a practice in India, when we do a training of first aid, we say it is a disaster medicine training. So I would request the moderator to kindly moderate the annotation requests that are frequently popping up on my screen.
We'll do that. We'll do that.
Yeah. So disaster medicine and the training that used to happen earlier in different places, people used to say that when we are teaching first aid, it is disaster medicine. First aid is not disaster medicine. In fact, first aid is not a part of disaster medicine. When we look at the previous statement, to do the greatest number of good to the people, to the maximum number of people in the shortest time possible, we cannot provide first aid during disasters. So there were few concepts which came into what complies of disaster medicine is it's an amalgamation of emergency medicine and community medicine along with public health. It's a upcoming specialty for all the physicians and people who are interested in this area, and it has so many challenging areas like CBR and warfare, psychosocial care, combat and technical medicine, and it contains a response and preventive approach. I would also like you to go through the definition of public health, because at this point of time, when we are dealing with a major public health crisis, probably even a lot of policymakers have failed to understand the public health importance and public health perspective. So public health is the science and art of preventing a disease, prolonging life, and promoting health through organized efforts and informed choices of society, organization, public and private communities and individuals. Now, I'm not here to criticize any sort of response or the step that we have taken, but let me highlight you one of a very critical challenge that has popped up in recent time. Now, we know that we have a very good amount of private sector participation of healthcare within the country. It's almost around 70%. Most of these private hospitals have good amount of ICUs and tertiary care facilities. There are a lot of doctors who are specialized in managing ICU and ventilatory care patients. Now, if for management of COVID, when we earlier started the response, there was an entire neglect of private sector, and the government started to manage it through the public sector network. So this is where the planning fault is, that you are investing in an area where you want to create resources and ventilators, procuring ventilators, and requesting people to use them. But a medical officer or a doctor within 2 or 3 days cannot be made expert in using a ventilator. And then the entire capacity of ventilators and the bed capacity in private hospitals went unutilized. So this was a very critical area. We could have managed a lot of patients much more better in private sector if both private sector would have come forward and if government would have coordinated with them in a better way. That is probably a model which has worked in several countries like Middle East, in South Korea, in Hong Kong, and in other places as well. What is the prime focus of public health? So the prime focus of public health is there are 3 or 4 major areas. It is prevention and response, prevention and treatment of disease, physical and mental conditions, data collection and surveillance. Now, we also in an emergency management area have a system of emergency operation centers, and we also go through the data collection and surveillance mechanism for collecting data for disasters, which are our indicators for Sendai framework. Among this as well, around 30 to 40% of indicators are correlating with the health sector, because even in disasters, what data we collect is on mortality, morbidity, the amount of disability happened, amount of psychosocial resilience, the issues the people are facing, the loss because of that, and a lot of public awareness issues promoting healthy behavior is also a major focus of public health. So I will give a very good example on that, why this is very important. A lot of people criticize when India started a movement called Swachh Bharat Abhiyan. Prime Minister coming on television and radio and talking every 15 to 20 minutes on using the toilet, washing the hands, closing the door of the toilet. Now, Prime Minister cannot get directly to the people and tell them that your inactions are causing a lot of disease burden within the country. So, in order to reduce the risk of diarrheal diseases, the waterborne infections, and the disease that spread through fecal-oral route, we have to instigate a behavioral change pattern within the community, and then instigate a sense of public health behavior for using of toilets on a regular basis. So this was such a big event which had a wider implications, but has to be conveyed to the public in a very, very neutral sense. Similarly, if you see a lot of film stars coming every now and then on radio and television, you might have listened Mr. Amitabh Bachchan coming on radio and telling you that if you are coughing for more than 4 weeks, it could be possible TB. So this has an impact on your brain. So whenever if you see one of your friend coughing for more than a week, you will advise him that you get tested for TB. And probably even 5 of them get tested, and if turned out to be positive, the real implication of this was the cost of treating a tuberculosis patient in India per month is around 16,800 rupees. The cost of treating of severely drug-resistant tuberculosis per month is around 70,000 rupees. And the TB treatment, you all know, that goes on for around 9 months. Again, India is one of the countries that has the highest uncompliance treatment rates with regards to tuberculosis. So that means that people start the treatment, but they don't follow it, and they have to repeat the cycle once again, and which leads to drug resistance, and then they have to be switched on to a higher or a stronger amount of drug. So this public health message is why the Prime Minister, even this time during the COVID season, we have seen 2 गज की दूरी, mask पहन के बाहर निकले. You have to reinvent the way of living after COVID-19. The reason is this public health messages. Just imagine a cost of treating and the issues that a patient faces when he is tested COVID-19 positive. So to avoid all this thing, this social messaging messages are of quite great importance. And of course, it is changing the way we are living. And why this? Why other countries as well? When COVID-19 is spreading to 216 countries, what are the major gaps that we are observing across the world? So basically, people and even the systems thought that the health systems across the world thought that the disaster management systems would be able to manage it. The disaster management system thought that the response agencies would be able to manage it. The response agencies thought that the health system would be able to manage it. So probably everybody passed on the buck by saying that I thought you would be doing it. And that is not just in India, but across the world, we have seen that equal distribution of roles and responsibilities, working in cohesion, sector-specific action. So for example, managing COVID would not require only the work of the health department. As you have seen, the police played a very important role. The Home Ministry played a very important role. All other allied agencies, including you name it, electricity sector, railway, telecommunications, everyone had a role in managing the public health emergency. But if they could have been thought much more better and much more in a precise way, if we would have started a bit early. So role, responsibilities, and handover. So we are not always going to be in the response mode for COVID-19. So ultimately, when we change to a easier role and getting back our lives to normalcy, we have to be very sure that when the departments now learn lessons from it and pass on these things within their systems as a lesson learned and be ready for better plans with better plans. Some of the initiatives that we did have worked quite well. For example, linking the airport, seaport, and land borders with the Ministry of Health. So we carried out capacity building and initiative through the National Disaster Management Authority for CBR and emergency management. And when this particular epidemic started in India, within no time, the ministry was talking with the land borders, airports, and seaports. So when you create such system cohesions methods, this works very well. So again, the role of municipal corporation, the healthcare workforce, the administration and governance, surveillance and documentation, central ministries and department, local body, NGO, grassroots level, everything needs to be defined in the biological emergency management plan. Now coming back to the topic, that what is the impact of disasters on health sector and what is the role of healthcare sector? So as we know that urbanization, rapid access to large population, poor global security and awareness, and transportation. So it took around only 10 days for this particular virus or any other virus to move out from a particular location and get into other countries. So nowadays we have a terminology called a disease anywhere is a disease everywhere. This was not the case earlier when the aviation sector and other modes of transportation, the cross-border transportation, was not that prominent. But nowadays, it has become a challenge for all of us. Similarly, if you take an example of India, where would your focus be? For example, everybody was keeping their finger crossed that if the COVID-19 spread occurred in highly densely populated slums in India, like in Dharavi, then it would go probably out of control. So you have to design a specific set of interventions for intervention in such area so that they don't act as a, similarly a lot of healthcare workers getting infected. That means the hospitals are also acting as a amplifiers of the infection. So this particular area specific interventions are very much important when we move ahead with the impact of disasters. So the disaster risk is on a severe increase because of increasing in population density, increasing settlement in high-risk areas, increasing technological hazards and dependency, increased terrorism risk due to biological, chemical, and nuclear, emerging infectious diseases and international travel. I would like to give you here an example of the CBR and emergencies, chemical, biological, and radiological emergencies. When we used to do training programs, the least weightage was given on the biological and chemical hazards. The nuclear hazards always used to take an upper edge because they had good demonstration techniques and the nuclear safety was of prime importance across many sectors. So when we talk about the in a training program for 7 days, there was hardly a lecture or two on biological disasters. But now, as you see, everybody is now doing almost a daily training program on biological emergencies. And every organization and institutions are coming up with the biological preparedness plan. So this is how weightage was predetermined. Even in the presentation, the slide says that the impact of biological disaster would be much more pertinent than a nuclear disaster because it would be widespread and it would be affecting almost all population. Similarly, what are the impact of disaster on public health? Now, I will move away from the biological perspective to the impact of disaster on public health, because not just this biological emergencies, but even earthquake, tsunamis, cyclones, floods are having different implications with regards to the public health perspective. For example, this is the time, because I see a lot of academia here, start thinking on the unknown perspectives which probably nobody has worked through. Our research and academia has a habit of going to the internet, looking on it, whatever is available, and then planning their study or planning their course around it. Why can't we move a step forward and start doing something which is not written in the books? For example, we talk about earthquakes. So now, in earthquakes, there are injuries which are fatal injuries which can kill people. There are injuries which are severe, like head injuries when a ceiling or something, an object falls on your head. There are traumatic injuries, limb injuries, which are of different categories. Then there are minor injuries like inhalational injury or cut and bruises. And then there are mental and psychosocial care injuries, which are long term. Now, when we know that these things are probably known, but not well documented as well. As we move further, do we have a system or a trauma system that is specially catering or doing a need assessment or simulation that probably in a city of Chennai, if an earthquake happens of this particular intensity, and if it is in this particular risk zone, whether it's in zone 3 or zone 4, if earthquake strikes, what should be the planning for trauma systems? Which hospitals can cater this many patients of this particular injury? How fast we can intervene and develop a simulation model around it? So this is the right time where we need to step in and do something on very specific issues. Again, the disasters carry a substantial health burden. It also, for example, hospitals. We have a tendency to take the patient affected by a disaster to the nearest hospital. But we don't know whether it's a TB hospital, whether it's a leprosy hospital, whether it's a maternity home or a private clinic. Will it be able to cater to 50 people whom you are taking around? So these all things are a part and bits of planning, and this only can be done through repeated mock exercise. And the systems have been evaluated across the country for that. But then we need to plan a way around that. Even, for example, during floods, there is an issue with regards to water quality and sanitation, increase in vector-borne and pathogen-related issues, a huge amount of malnutrition and decrease in essential supply of healthcare. For example, people having diabetes and hypertension often get worse after such disaster and emergencies. Similarly, climate change is leading to certain other emergencies like increasing frequency of lightning and thunderstorm, in heat wave increase across the country. So heat wave related deaths being reported. So you have to apply certain science behind it. I would like to give a good example with regards to climate change and health here. Right? For example, if you might all agree that when we see the map of India, Rajasthan is probably the state in India we all know as the highest temperature recorded in India. But if you look at the pattern of heat wave in the country, it is mostly located along the coastal borders of Gujarat, Maharashtra, Andhra Pradesh, and Orissa and West Bengal. So if you see that the most affected state is Andhra Pradesh, Telangana, because of heat wave. So why this is so? So there has to be a science behind it. It's not just the temperature that creates heat wave, but also the humidity combined, and then there are several other factors which lead to a heat wave effect on a person. So what are the health needs that we have to work in future on to establish the healthcare priorities, follow trend and reassess the priorities, evaluate program, detect and respond to epidemics, and evaluate the quality of our healthcare system. Now, who will do it? As a broad example, the disaster management people, the doctors. Again, when we talk of doctors, you all know there are so many specialties in doctors. So, which is one specialty which can directly blame on to do all the work, and rest other would do nothing. So, I call it disaster showcaseism. For example, since I've been working at the national level since many years, after every disasters, I get a good amount of call from, say, gynecologists or say pediatricians or orthopedic people, and they request me that, sir, I would like to do something in disaster management. I exactly ask them what. No, sir, I want to do any certificate course which will help me in getting promotion. And because nowadays disaster management degree is very important in every profession. So I said, are you going to really apply it in your practice? They don't have an answer for that. But the thing is, since it is in fashion, everybody would like to do it. So, but that should not be the case. Everyone is important. For example, after the Nepal earthquake, the trauma surgeons and the team of trauma care experts and orthopedics going to Nepal to treat an injury of the people affected by an earthquake was not necessary. In fact, we could have sent more nurses, more emergency medical technicians, more physiotherapists and occupational specialists, and more students who could be there and take care of the people who are being affected, whose life have been saved for a longer duration of time. So every time when we want, so this is what we have learned over time from by responding to several disasters and public health emergencies, that it's not one person, it's a group of different people, and everybody has a small amount of contribution that he needs to do with regards to emergency management in his own working area. The four main areas with regards to this is capacity building, joint and convergent coordination, strengthen data collection and surveillance, and public awareness, as I mentioned earlier as well. So capacity building at what level? The national, state, district, block and village level, multi-sectoral curriculum to be focused on prevention and response, institutionalization and regularly delivered. For example, I will, as you are a college, I would like to ask that, do you perform regular mock exercises and drills in your own campus on a regular basis? So then if you want to train the community, how much to train, on what to train? Do you think that training the entire population of 137 crores on first aid would be necessary to deal with disaster management? Answer would be no. We have to do a very focused amount of capacity building with regards to how we want to go ahead with that. I would request the coordinator to kindly regulate few mics which are on.
I will request all the participants to kindly turn off their mic, because we are such a large number and it is very hard to control each one. And I am turning off so many participants so many times, they are again turning on the mic. Next time we will be forced to expel from the webinar. Please kindly maintain the rules and regulation of the webinar.
Yes.
Sir, please continue, sir.
Yes. So when we talk of the medical management and mass casualty, what are the greater initiatives which you can build upon when you are looking about healthcare sector dependency? So if you go to the NIDM website, we have several guidelines on medical preparedness, mass casualty management, hospital safety, biological disaster. There is also a guideline on management of in post-disaster, minimum standard of medical care in the shelter, and beyond pandemic preparedness, along with a guideline on post-disaster psychosocial care. Many of these guidelines have been very key in across the country when we are designing several initiatives, and many of these guidelines are also currently under the phase of revision. So since this pandemic has taught us what we need to do, so what we need to do is we need to go back to our guidances. We have a lot of tools which we can refer to. We have to go back to them and then learn from there. If you take out the first document on the biological disasters, whatever is happening in this particular pandemic is written in this book, which was released in 2007. So, but the problem is we did not have the courage to download this book or open this book and go through each and every page to include it in the planning process. So coming back to the global frameworks, how do the global framework affect us? Because this guidance and everything needs to be updated over the time. If you look at the disaster risk reduction, the climate change and the sustainable development framework, all three have given importance to health in it now. So And the best part of these three frameworks are, I would request Arvind Verma to kindly, there are several mics which are still on and I am not able to, I'm getting a continuous disturbance.
I am continuously expelling them, sir. No worries, sir.
Okay.
I am checking.
All right, no issues. So the best part of these frameworks are, now everybody across the world has realized that if we don't do anything now, then probably it would be too late. So hence all these frameworks are time bound and responsibility based and action oriented frameworks. So if we look at the framework on disaster risk, which is the Sendai framework on disaster risk reduction, in the first, second framework, the word health was mentioned, say, 5 and 9 times. In this Sendai framework, the word health has been used more than 30 times. So this shows that how much important the health sector role is increasing in the global frameworks as well. So, and the first and the second indicator that we want to achieve is to reduce mortality and morbidity. So this again is a major role of health sector. So when all other sectors are working together and they don't collaborate with the health sector, again, the state of absolute resilience would not have been achieved. Similarly, we have a lot of work to do and our work is never ending. So I will give even the Prime Minister 10-point agenda. When it was released in the Asian Minister Conference on Disaster Risk Reduction, we had a key messages that were delivered with regards to health and disaster risk reduction, which says that the resilient health systems and all actors need to play a role. So now when I talk about so many issues and in so much of depth, what are the work that we all need to do? First of all, we have to identify what, as in medical, you are aware about the concept called triage. Triage means sorting out the things as sorting out of patients as per the criticality. So if there is a sick person, you attend to him first. But if a person is shouting and raising the hand for getting the treatment, you will probably attend him later because he will not die since he is alive and he is shouting. So this is the mechanism of triage. Even we have to incorporate when we do our planning, when we do our strategy. So we cannot do everything, even as a public health expert or even as a disaster management expert. So taking one particular area, whether it's a trauma care system, whether it's psychosocial care, I would encourage all of you to come forward and at least do something in a collaborative manner by defining the scope. Do some desirable activities, some essential activities. What will be the desirable activities? Capacity building within the community, which you can transmit as a desirable activity. What are the essential activity? Research. Now, and surveys. Broad research is an essential activity. But the thing is, what is a vital activity? So vital activity is documentation of operational research. Whatever is going around you, keep an eye open. There are a lot of lessons which you are even learning from COVID-19. If you don't document those lessons, these lessons will just go away. And then you missed out on doing vital activities because you are not able to design your scope. You cannot differentiate between desirable, essential, and vital activities. So this is all as a team we need to do, because everyone is thinking that I'm a researcher and I will be able to solve a lot of challenges. So kindly do not handle this alone. Build partnership and do it in a way which is proper and in a justifiable manner. So what are few research areas? For example, Delhi temperature and air pollution and mortality and hospital admission related research is one which we need to. Weather patterns and asthma occurrence. Daily and weekly temperature and food poisoning issue cases, the climate and environmental influences on viral disease, drought severity and mental health related issues, modeling future changes in health risk which relate to changing climate change scenarios. For example, why is the number of deaths related to lightning still occur is increasing in only few states in country? So this particular area needs to be focused. So challenges are still there, but I would be very blunt that delivering certain point. Nothing works unless and until it is needed within the community, backed by the government policies, and facilitated by partners for execution. So we all also have an experience of attending a lot of workshop, trainings, seminars, conferences, and initiatives, which is hardly 10% of the work. We get excited while we hear some good speakers, but then we don't focus on the 90% of the work that needs to be done after that. Again, as everyone has realized that health sector is one of the toughest nuts to be cracked, and it has to take a lot of thinking and system approach when we work for the health sector strengthening. And community capacity building is a far distant dream. Still, we did a risk perception survey with regards to COVID-19 in the country. The results were shocking and amazing. So around 96% of people in India still think that they are not prone to COVID-19, which shows how community is prepared for dealing with this particular disease. And they are very sure that COVID-19 can happen to anyone within the community, a next door neighbor, people working with them, the shopkeeper or a security guard working for them, but it cannot happen to them or someone from their own family. So this is the lowest amount of risk perception which is existing in our community. Hence, if you want to teach the community, you have to put in a lot of effort, and training or webinars is probably not the solution for it. So we have to think on something new. What will be the take-home messages from my presentation would be, don't play in isolation as a specialty. Whether you are an earthquake engineer, whether you are a disaster management expert, you have to finally merge you have to talk with your friends. I am one of the best examples for that. Basically, I am a medical professional, I am a doctor, but my best friends are not doctors. I would not choose to be friends with doctors. My best friends are GIS experts, the scientific community, the researchers and other people, and even laymen who I have nothing to do with disaster management or my medicine stream which I practice. The reason is, if I have people around me who are having of the same thought process, probably my knowledge level would never increase. So to constantly learn, to constantly innovate, and to constantly generate a newer perspective in your work, you have to be friends with newer people. While conducting around hundreds of training programs across the country, I always make sure that a doctor becomes a friend with a firefighter, and a disaster management become friend with a security personnel. So this is a newer model of friendship which we need to do in this. Disaster will not just happen in other states and in country. As I just mentioned about the risk perception, Uttarakhand में बाढ़ आएगी और चेन्नई में नहीं आएगी, ऐसा नहीं होगा. So everybody has to be prepared. We are not superheroes yet, so prepare yourself and calculate your risk accordingly. Even in future, the epidemics are unavoidable, but if we do not have better systems, we will not be able to deal with them properly. The problem that we have seen, this is probably an old slide, but still it is very relevant, that the data collection and analysis is not going to be done by your colleague. If you want data, at some point of time, you also have to be a part of the data entry system as well. You also have to give data to someone. So then only you will create certain data models and around the country. So, and how you survive individually and your own security holds the key to your future. So we aim for an already and safe, smart, healthy and resilient India. The positive notes are, we as a healthcare system are a last hope to many people. And it is not always, even if you see 24/7 hospitals are overloaded with people. Even during disasters, whether you are affected or not, you will probably go to the hospital because you will think that somebody is there to listen to you. And probably the systems are not in place. The city administration would not be there to listen to you. But a doctor within the hospital is always going to be there to hear to you. So we always, as a healthcare system, are going to be overburdened. But the best part is that we never had and we never will deny our services. So, and how this can be achieved, that when we make everything in India.
Excuse me, sir.
Yeah.
Sir, this
is my last slide.
Yeah. Yes, sir. Sir, kindly finish. There are two more speakers to go.
Yes,
sir, thank you.
Yes. So when we are building everything in India, why can't we make our resilience also in India? So, and this can be achieved through developing a command capability and capacity. If you are aware that even Mr. S.N. Pradhan sir also mentioned that the response is now much more scientific. Earlier, it was knee-jerk reaction that we used to have. Whenever there was a disaster, we would deploy someone. And we were seeing systems being resistant to changes. Now it is being slowly converted into resilience. So with that, I would like to thank all of you for attending this session, and definitely I hope my talk would have been a useful one for you. Thank you.
Thank you, Dr. Shurab Dalal, for such a wonderful presentation, very practical and very knowledgeable. One of the things that we could take it from this is the responsibilities and handover. I think we all have an individual responsibility, and we need to hand over these things, whatever we have learned and whatever we deliberated today. And I'm sure decreasing vulnerabilities is also one of our key areas of combating in the as a role in the health sector. I think that is what we need to be prepared for. Youth by Dr. Chow Sing, and he is already online. And without any further delay, I would request Dr. Chow Sing to do the presentation. Before that, we have one announcement for all the participants. Kindly mute yourself and be aware that your app is muted. And then you please also stop the video that you are sharing. I think that will help the others and the program to go on smoothly. Some of you are asking for presentations, the PPT presentation of the presenters. We will get the permission. If they allow us to share it with you, we will definitely share it with you. Now over to Dr. Chow Sing on the role of youth in disaster.
Okay. I'm sorry for the... And I'm just going to share a story that actually 3 stories that what youth has been contributing during the disaster and crisis. First story would be the in 1999 there was a major earthquake in Taiwan, and many people lost their life, like more than 2,000, and more than tens of thousands house collapsed. And in my presentation, you will see in the first page, I saw what a 20-year-old youth can do during this major disaster. There were 2 kinds of youth when in their age of 20. One of them are the university students. A very beautiful university nearby Puli, central Taiwan, and as a college student, they're regarded as elites of the society, and the president of the university, who guaranteed to the parents, saying your kids will be well protected. And what he did right after the disaster, the earthquake, he sent more than a couple of thousand students away from the village that has been devastated by the earthquake. He sent them to Taipei, the capital, and to the top university in the country, and have them continue their study. But on the other hand, another group of 20-year-olds who were serving their compulsory military service, they were sent by army to go to the village and to clear up the grables and to try to find the people who were trapped. So the village people were very angry about the decision of the president, saying, the university here only consuming us and do not contribute anything. So in the next page of my presentation, there's a group of youth who were building a house. This is a project organized by church right after. This group of young people, we assemble themselves in Taipei, and they will get on the bus, and then they will come to central Taiwan, which will take them like 2 or 3 hours to reach. And before they come, they have a scout team come to the village to look for especially the older people who lives alone, and if their house has been damaged, they will go to the house and measure the land, the piece of land they have, and they come back with a floor plan. And the next week, the group of church youth, they will come to the village and to help to build a house. It's amazing. Only take like 2 days because they are prepared and they are skilled. Some of them are skilled. So in either 2 days or they come back next weekend, they will rebuild or they will build a new house for, of course, a temporary housing for the people who's been affected by the disaster. And they are the ones who has been left out because sometimes the government system doesn't support the situation. And but at the same time, the negative story heard from the university. At the same time, 20 years ago, none of any university has the experience, but very many young people voluntarily, they rush into the devastated area. They stay there for a couple of months. Some of them even stay there for several years. And eventually they walk through the disaster with various communities. Some of them have become very important persons in the society, and some of them now are teaching in universities. Actually, one of them has come to India to MCC with me. This is the first story. The next story I'm going to share with you is 10 years ago, 11 years ago, there's a major disaster. This time it was a typhoon. That the earthquake hit central part of Taiwan. This time the typhoon hit southern part of Taiwan. And this time the typhoon brought in lots of heavy rains. So it caused many flooding, landslide, and nearly 700 or 800 people lost their life, and more land and farm has been washed away. This time we are better prepared. So CZCU, which is 1 or 2 hours driving away from the devastated area, the university, I was involved in organizing the students to go to the affected area. And this time, since we are better prepared, not only students, but the faculty members of the university, we use school bus. Every day we send batches of volunteers to do the relief work at the area. So if you can see, because I don't see on my screen, if you can see the like, there are school bus and there are people from the school. They went to the affected area and to help to delivery and do the cleaning, etc. Not only that, one of very important things that the university collaborated with local authorities is that the city government spend part of the money they receive from the relief fund. They have CJCU, our university, open up a social work class in the disaster area, where we managed to provide social work credit hours to local youth and adults. Because based on the law in Taiwan, if you want to be a certified social worker, you need to take credits from university, and it's up to 45 credit hours, and also plus 200 hours of practicum work. So CJCU, we collaborate with local authority. We had this social work class. This in 3 years, there were more than 60 people who took the credit hours, took the class, and 23 of them become eligible to take the national examination to be a certified social worker. What is important is not just to be certified. It is because you have received these credit hours and you have the proof, then you will be, even you worker, you'll be eligible to receive government fund to do local welfare work. So this secured the human resources, because very often after disaster, people will move away from their hometown. But because of this social work credit hours class, there are more young people who can stay in their village and to do the service work, and even until now. And so if you see the slide saying be the long-term partners with of the
Mr. Choi Singh sir, can I share your PPT?
Yeah.
Can I share your PPT? Can I share your PPT, sir?
Yeah, sure.
Oh, okay. Just give me a minute. Just I have received your PPT. Hello.
I think I've sent the PPT.
Yes. I have just I am able to please.
Hello. Sir, good afternoon, sir. This is Darshika from IGNOU. Can you hear me,
loan
sir?
வாங்கி உங்களுக்கு எப்படி பிரயோஜனமா இருக்குதுன்னு சொல்லி ஒரு வீடியோ மாதிரி கொடுத்தீங்கன்னா நல்லா இருக்கும். வாய்ப்பு கொடுத்தீங்கன்னா மற்றவங்களுக்கு கொஞ்சம்
Hello.
Shall I continue?
Hello, sir.
Yes.
You can continue.
Okay. So 10 years after the disaster, with authority, and because we have built a good connection with local youth, so even 10 years from now, we like last year, we managed to organize an international forum for this post-disaster conference. And also our students will visit villages to join their cultural activities. Reconstruction is not only the buildings, not only the farming and productions. Reconstruction has to do with culture also. So after the disaster, actually this time is in many indigenous people's areas. So they also decide to rebuild their culture. Now, I've come to some slides which I've taken 15, 16 years ago when I visited Chennai and southern Indian villages. These are the picture I took after the tsunami hit the coastal part of India. Taiwanese church received quite a few donations supporting India's tsunami. So the church invited me to join the team to visit India and to see how and what we can do. I got that opportunity. I requested that since I'm joining, I request the church allow me to organize a group of university students to come with me. So after that, for 6 years, we visited Chennai for, I think, 6 times. And there we had a chance to work with village people in some communities. We contributed in one of the village of their house building. And the best part is we become one of the founding members of International Social Work Center in MCC. So now I've come to the conclusion of my presentation, which is youth can play various roles of before, during, and after disaster when they, took the responsibilities. And youth role can be varies differently in different countries, in different societies. Some societies, youth may face more, suppress. That it may take them some can actually do something. And the educational institutions bear the expectations and the responsibilities may reflect and even debate on what roles youth should or can be taking regarding during the crisis and
Hello, sir.
disaster situation. Yes.
Sir, due to time constraints, sir, we have to finish little, sir, in short, sir. Okay. Because we have one more speaker.
I have come to my last sentence. Okay.
Okay.
So,
thank.
Yeah. So my last word is youth can and should take the initiative when crisis and disaster happens, since a crisis or disaster actually means something that the existing system cannot handle it well. So youth should and can take the responsibility and make a difference. Thank you very much for your attention.
Thank you, Dr. Chowsing, for your brief and the enriched presentation on your experience in bringing the youth. I think it is a lesson for all of us, as most of us as participants are teachers and students. I think it's our lesson that how the community expects the universities and students to respond in a disaster situation where it's just not a mere degree. I would like to quote a quote that Dr. Chandran Devnesan, one of the first Indian principals of Madras Christian College, he said, an educational institution which is not relevant to the neighborhood do not have a right to exist. That's what he said. I think it's so important that educational campuses and other community youth need to be part of this community resilience building. That is what we've been talking about right from the morning. I think that's a line of thought that's coming out. So now we move on to the next session. So before we move on, we would like to thank Dr. Chowsing and kindly be online. There may be a lot of questions at the end. If we have time to take on questions, we may ask a few questions. Now we move on to the next session. We have the inaugural speaker, Shri S.N. Pradhan, IPS, the DG for NDRF. He is with us and he is going to detail it on the disaster response and preparedness. One of the words that in the morning that we were sharing was the culture of And disaster preparedness, that is one of the things that we were talking about. And I'm sure that he is going to detail it, and we're going to receive some more inputs on that area. Over to Shri S.N. Pradhan, IPS, DG, NDRF.
Thank you very much, moderator, and thank you for inviting me for this special address. I thank the Department of Social Work, Madras Christian College, and I believe a lot of students are online. So I'd like to start with the basics. I'm sure some of you may have some idea about these basics, but I think it is worth repeating because it's vital that we have the same perspective and we are on the same page as to the preparedness, because we are talking about the crisis and disaster management preparedness, and what exactly is this preparedness? Yes, culture is certainly the vital aspect of preparedness, but culture also has to be worked upon. Just like you work on any relationship, including a marriage, you just don't let it drift. So you have to work upon it. This is the working upon. Your relationship with disaster has to be worked upon. You must know as a society that disaster is part of the equation of life. Distress, good and bad, we know that good and bad, life is of good and bad. So disaster is the bad aspect of life. And whether you call it distress or disaster, the higher, the magnified form of distress is disaster. Distress happens to one individual or a few individuals, and a disaster happens to the society. Distressed society is disaster affected society. So it is very critical that we must understand that disasters are not exceptions. Now, more and more so, they are the rule. And I've always believed that there is this myth that disasters don't happen regularly. In the last 20 years of this century, there have been several big disasters where more than 1 lakh casualties have happened. Just to give a few examples, the Haiti earthquake, almost 3 lakh casualties. The Kashmir, Hindu Kush, Pakistan, Central Asia earthquake, where the POK was affected, more than 1 lakh casualties. The Cyclone Nargis, multiple countries including Bangladesh and Myanmar, again more than 1 lakh casualties. Then we have smaller disasters but many casualties again. The 2019, for example, 2019 we had the cyclone Phony, but not more casualties. But look at what we are facing now, the pandemic, the global pandemic, and the casualties could go not in terms of lakhs but millions already. So disasters are not, as I said in my first opening remarks earlier, this myth and this assurance, probably a lie that we tell to ourselves as individuals and societies, that disasters don't happen, is something that we must come out of forever. And there are 3 paradigms I talk about, or 3 disclaimers. To start to have a culture is to first do a reality check. And the reality check are 3. Number 1, disasters have happened. They have always happened. And they are happening more. So the second paradigm is they are happening more because of climate and ecological changes, which are anthropomorphic, which we have actually brought upon ourselves by our own practices. So disasters have happened. Disasters are happening and they'll happen more. They will happen more. And disasters can happen to all of us. These are the 3 disclaimers or paradigms that I want to impress upon and embed in your mind and heart, that disasters have happened, disasters will happen and will happen more because of whatever we have done. And you can call it the human sins, but the sin is now coming full circle and impacting us. And then finally, disasters can happen to all of us. And individually, I think everybody must also think that disaster can happen to me. You know, in the context of COVID, every scientist has taken a lot of pains to try to make everybody else understand that please prepare yourself with some paranoia. If paranoia is necessary, then prepare yourself with that paranoia that COVID can happen to me. Only then you will be prepared. If you think that it will only happen to others, then you will never be prepared. And that is the basic of having a culture. A culture of preparedness is to believe that it can happen to you, that it can happen to your family. If you don't believe that, if you somehow lull yourself into that kind of a mindset that it will not happen to me, it will happen to others, that will be the biggest mistake. And that is why we do not have a culture of disaster preparedness or disaster readiness. But because we are talking in terms of the Indian scenario and would like to focus on the Indian scenario, so let me spell out how NDRF has come about and what exactly NDRF's mandate is. Now, before I go on to how the ecosystem was set up, how some kind of a persuasion into the culture of preparedness has come, we have to go back to probably three big disasters in this country, which happened in the space of 5 years. The first one was the super cyclone of Orissa, 1999. Disasters had happened before this, but three incidents or three events woke us up, so to say, from the governance point of view. And it happened in the space of half a decade. The super cyclone of 1999 in Orissa, October 99, approximately 10,000 plus lives lost. Bhuj earthquake just 2 years later in Gujarat, 26 January on Republic Day 2001. Again, more than 10,000 lives lost, 13,000 odd to be exact. More than 1 lakh persons injured. And just 3 years later, you are in Chennai. The tsunami happened in 2004, 26 December 2004. More than 12,000 deaths reported, many still missing. Three events, three disasters back to back within a space of 5 years. It shook us up, and just as well, because certainly the government of the day realized that you cannot take disasters and tell yourself that disasters will not happen and it will not impact economy and society. It will impact economy, it will impact society. And by the way, in terms of total economic loss, India stands as the fourth most devastated country in terms of economic loss after the US, China, Japan. India stands in terms of the economic loss. And who bears the impact of the loss? The poor, the disadvantaged, the lower income sector. They are impacted the most. Their lives are devastated, literally devastated. So while it's a disaster for the country, it's devastation for the poor, the economically disadvantaged. So to come back to the point, these three events woke us up, and the government set about the task for a change, set about the task in earnest to set up a disaster response or a disaster preparedness ecosystem. There is a very beautiful analogy from Marxism, which says dialectical materialism. You know, there is a material situation, then the human action on the material situation is deliberate, and then there is a change to a higher situation so that things improve. So there was a material situation of non-response to disaster. Then the policy makers acted on that material response situation, and then an ecosystem was built. So we had what is called the Disaster Management Act 2005, the Disaster Management Act. out of which came out 2-3 very critical institutions. One is the National Disaster Management Authority, the highest policy-making body which takes care of disaster response. Highest policy-making body, chaired ex officio by none other than the Prime Minister. Then there was this NDRF. Section 44 set up the NDRF. And what does Section 44 say? And this is very important. Section 44 of the NDMA says, there shall be constituted a National Disaster Response Force for the purpose of, and mark my words here, for the purpose of specialist response to a threatening disaster situation or disaster. To a threatening disaster situation or disaster. So we go back to the issue of preparedness or response. Response is not when the disasters have happened. Response is all the 3 dimensions, before, during, and after. Prevention, mitigation is also part of response. Recovery after the disaster happened and rehabilitation is also part of response. And of course, when the disaster is happening, you save as many lives and property as possible. That is also part of response. So response is not unidimensional. Response is multidimensional. And that is why I call the culture of response to disaster. The response culture is embedded in your mind and your practices. Just like a Japanese kid of 4 years old, when the hooter goes out for the mock drill, for earthquake mock drill in his school, he or she runs out just as he or she would run out when the actual earthquake happens. He or she does exactly where she has to hide and take shelter as the actual earthquake would have happened. And he or she can actually respond and understand to the messages that come on his or her mobile or on the TV when the earthquake drill happens. It is embedded into their mind that you are a disaster-prone country, you are a disaster-prone people, you are a disaster-prone community, and community is nothing but a conglomeration of individuals. And so when there is individuals who practice a disaster readiness culture, the community benefits, the state benefits, the country benefits. So to come back to the point that until 2005, what were we? Until 2005, we were a reactive and relief-centric setup. Why reactive? Because we thought disasters you cannot do anything about. So let the disasters come and happen. What can you do? What can you do is provide relief after the disaster has done the damage. After it has killed a lakh of people, after it has made homeless another million of people, after it has done great devastation to the crops, you can come and provide relief. So relief-centric approach. This relief-centric approach was reactive, and that proved to be our undoing. Then suddenly we realized that you can meet the disaster as it happens, and you can do a lot before the disaster happens. In strengthening the infrastructure, preparing the community, empowering the community, training our own disaster response forces, the police, the civil administration, the home guards, these all the stakeholders that can potentially handle a disaster. So before, during, after, this was drilled into our system. And very interestingly, just see the analogy. Because it was relief-centric till the early 2000s, the disaster management and disaster response mandate was as a subject matter with the Agriculture Ministry. So please understand this. It was with the Agriculture Ministry. And then it was moved to the Interior or the Home Ministry. It is very significant that for once it was realized that this is impacting the security of the nation, the economic security, the social security, and the territorial security, in the sense that it can impact it. If there is a tsunami, it can come into the cities, into the coastal towns, into the villages. So it was seen as a national security to secure the people from disasters is a governance responsibility. So please understand that first there has to be an awareness in the governance system, in the policy system, a recognition and an acceptance and acknowledgement that disaster response and preparedness for disaster vis-a-vis the community is a governance responsibility, and it is not a peripheral governance responsibility. It is a mainstream governance responsibility. Now, around the world, there is a lot of realization that the culture of disaster governance, efficient disaster governance, is actually a mainstream aspect of governance. It is not a peripheral aspect of governance. It's a mainstream aspect of governance. And governance will be judged just like a man is judged by how he faces adversity, not how he lives a normal life when nothing is wrong. A man is judged, his character is judged by how he faces adversity. The character of governance and the character of society will be judged, community will be judged by how they face disasters, adversity. Disaster is adversity or at a higher scale, and it will be judged, and efficiency will be judged, resilience will be judged by that. Now we have come to the point aspect of resilience. Now resilience is very critical. Resilience is the aspect of being strong enough. The Sendai framework defines resilience as the resilience to absorb a disaster, the impact of a disaster. Absorb. This is a very interesting word. Absorb the impact of a disaster. That means you are able to take on a disaster as it happens. Again, a Japanese example. Because I'm from the police, I'll take some examples which may have some law enforcement angle. Now, there is a force called Kidotai in Japan. It's part of the police. Japan does not have many riots, but Kidotai is the riot police. And what is so special about Kidotai? It can handle any riot. It can handle the most violent of the riotous mobs and stop the riots on its tracks. Even if they are firing bullets or sending Molotov cocktails or throwing petrol bombs, they can be handled even if they are most violent. And they can be handled with effect, but without doing much damage to the life and property around. Stop a riot in its tracks. Today, it is very important. You cannot stop a disaster on its tracks, but you can have the minimal damage to your infrastructure and life. So you can see that in the Cyclone Phony into 2019, compared to Cyclone, the Orissa cyclone that I talked about in 1999. 1999 Orissa cyclone, more than 10,000 deaths. Some say more than 15 to 20,000 deaths actual. Cut to 2019, exactly 20 years later, we have traveled a long way. The death toll was exactly after 10 to 12 days, it was found to be 64. 64. Just imagine nearly 10,000 plus and 64. You have come down to less than 1% of the toll which was there 20 years ago. So yes, we have traveled a long way. But I would still qualify, even as a head of the disaster response force of this country, that we are still far away from building a culture of disaster response. And that, in terms of the Sendai framework, and I would urge all the students to look up Sendai framework on the net and educate yourself. Sendai framework says the really disaster prepared society or disaster ready society is a resilient society. Resilient. What is resilience? Again, I take the COVID metaphor. We have talked about that COVID will ultimately happen to everybody, but there will be a survival of the fittest. Survival of the fittest. What is the survival of the fittest? That person who has the best immunity will be the fittest. What is immunity? Resilience. Nothing but resilience. For COVID, it is resilience. For a disaster, the immunity is the resilience of the community. Now, I know that in Chennai, because of repeated cyclones in the Tamilnadu coast, repeated cyclones in the Andhra coast, repeated cyclones in the Orissa coast and the Bengal coast, there is already talk about making disaster resilient infrastructure in all the coastal towns and villages. All the coastal towns and villages. Why would you want disaster resilient infrastructure, and what in the disaster resilient infrastructure? You have this PM Awas Yojana, the housing for the poor. It is high time that the housing for the poor in the coastal villages of India should be disaster resilient, should be able to withstand a cyclone and indeed a flood. Bangladesh is already showing the way. They have started making houses for the poor which can withstand floods. And that is happening around the world. With the advent of technology, and that is my final point, with the advent of technology, we are now able to fast track a culture of disaster resilience. We can fast track. But as is always said, it is not the machine, it is not the infrastructure, but the man behind the machine and the infrastructure, the human beings. We are the live, vibrant entities which will defeat a disaster, or it will be allowed to succeed. A community defeats a disaster, not infrastructure so much. Infrastructure is an aid to defeating a disaster, but the community ultimately is the victor or the vanquished. So it is very critical that the community gets ready. You know, academic institutions like this like the Madras Christian College and the Department of Social Work, I cannot thank you enough for initiating such discussions, but this has to be really widespread. And it is in our own country that we have good examples. We don't have to go very far. Take the example of Kerala. For example, the local self-government has a disaster response plan. The panchayats have a disaster response plan there, and the volunteers are marked. Take, for example, Orissa. They have learned the hard way, but there are more than 50,000 community village volunteers who can help in handling a disaster or a cyclone, a flood. There are nearly 1,500 cyclone shelters which are built with the help of the IITs. So this is a culture. So it is, you could see that impact. This is the last point I want to make, that you could see the difference of culture in the terms of impact of the same cyclone in Orissa and the same cyclone in West Bengal just the other day, Cyclone Amphan. I sent the teams of NDRF 7 days in advance, both to Bengal and to Orissa. But what happened in Orissa? Not a single life lost. Not a single life lost. Because the villagers were amenable to be shifted to the higher ground and cyclone shelters. Because they have embedded culture that, yes, I have to move to safer ground. Even if I lose my property, I must move to safer ground. The government, the local agencies, the district administration, the local volunteers, and the people affected are on the same page on this culturally. Value-wise, they realize the value of safety in the terms of facing a disaster. What happened in Bengal? We struggled with the process of evacuation because people just would not listen. And the local administration was not so very convinced that it needs to be done and when it needs to be done. Finally, we had about 90 deaths, which I feel could have been avoided. So the culture, the value proposition, the priority that you give to preservation of life, all this matters a lot. To sum up, we have come a long way. So if you make a comparison between 20 years ago and now, yes, we have come a long way. But I would say it is now still the requirement of going on a fast track mode to embed and establish a culture of disaster preparedness. Unless we do that, we'll be not smart. We'll not be losers, but we'll not be smart. Being smart is to be able to anticipate the future and prepare for it. And a country which prides itself in being the software power of this world, some of the best brains of this world, some of the best scientists, some of the best, brains of the world. I don't think it is far away out of reach for us to be able to prepare ourselves. And the last lesson that I must share with you is, in a disaster preparedness scenario, the culture of disaster preparedness, it is not only the government agencies which are critical. The community is critical. The public and the private sector are critical. If there is one lesson that I, as DG of NDRF, has learned, this is the lesson. It is all hands on board. All hands on board. Everybody on board. You don't distinguish between private sector, community, government, local agency, federal agency. All hands on board. That is the real representation of a disaster preparedness culture. Thank you and Jai Hind.
Thank you, Shri S.N. Pradhan, IPS. Thank you for beautifully putting it together, the disaster response and preparedness. And thank you, sir, for passionately speaking on this issue. That shows how much you are involved in this whole issue. Sir, we have one question if you are here still online. Shri S.N. Pradhan, IPS, if you we have one question, if you could respond to it.
Yes, please go ahead.
Yeah, there is one of the participants who has asked, India is a multicultural society and we have different cultures, different groups and communities of people. And in a culture where, and culture is so important, how can we practice it in our society, especially the culture of disaster preparedness, when during lockdown or during any other normal day, when people are not obeying traffic rules and all those things. Now, how do we prepare this community at ground zero? How do we prepare them is the question.
And I'll be the last one to say that preparing or embedding culture is easy. If it were easy, it would have happened already. But let us not forget that it has been done. It has happened. I took the example of Japan and South Korea. After all, they are people like us. They also are built of flesh and bones, just like us, and blood. But how could they imbibe this culture? And why go to Japan and South Korea? How could this culture be imbibed in the coastal areas of Orissa and in Kerala, that we must respond to disaster? And only just before this, I was in a webinar just like this, and the member secretary of the Kerala Disaster Management Authority was on board, and he was saying that why Kerala is responding in a different way to most other states to the COVID pandemic, because there is an internal conviction down to the last villager that he must comply with certain guidelines and he must be part of the culture of responding in a unified manner to the COVID challenge, because either we are in this together or we fall together. So this conviction, it comes from a culture, and there is no option but to embed this culture. And either we learn it the easy way or the hard way. If people are still being indisciplined, whichever state they are being more indisciplined, there is more damage. Whichever state is being more disciplined, there is less damage. But to answer the question, it does not mean you stop trying because people are indisciplined. You must keep trying. Let me give you a last example which illustrates this point. In Nisarga cyclone in the Arabian Sea just the other day, in Sindhudurg district and in some other districts, Raigad district, people were unwilling to come out of their homes, saying that this cyclone is not so intense, so we will be able to survive in our homes. They were not coming to the cyclone shelters. And finally, they were actually shown visuals of Cyclone Amphan in Bengal and said that this is what happened to their houses. And I must confess that in the morning of the cyclone, those people who were still, phlegmatic, did not want to go. They were actually forced to go. And then later on, they thanked us that, sir, had you not taken us out forcefully, we would have probably died in our houses or in our tenements. So, yes, there are some ways of handling situations, but whether we learn it the forced way or the unforced way or the voluntary way is a choice. But the choice means the choice between life and death. We learn it the hard way, we learn it the easier way, or our self-learned way. It's a choice. It's a human choice.
Thank you, sir, for explaining it very patiently on this issue. Now we have another question to Dr. Saurabh Dalal. Saurabh Dalal, if you are here, kindly note this. The question is on mobile healthcare services. The participant have asked, mobile healthcare services have played an important role in present times. So should those quick services be made part of our health system and services permanently, or molded in a better way, especially in a post-disaster or during disaster time? Can you respond to that?
I think Dr. Saurabh Dalal is not here.
Okay.
So we can put another questions to the speaker.
Okay. Then can I ask another question to Shri S.N. Pradhan? One more question. Sir, there are quite a few of them have asked, how can, after listening to the presentation on the students' role, how can students be part of the NIDM, be part of NIDM, and they can contribute it even as they're students or at different spheres like an educational institution? Can you elaborate on that?
Yeah, just a small correction. Part of NDRF, I think.
NDRF.
Yeah.
NDRF.
Yeah. Just to illustrate this point, in the last 6 months, we have, before the COVID thing happened, we have trained nearly 10,000 NYKS volunteers, Nehru Yuva Kendra volunteers. Nehru Yuva Kendras are in every district. What have they been trained for? You see, NYKS volunteers are already helping government in evangelizing or propagating about the schemes. But this is an additional skill set we have given them at the behest of the government of Department of Youth Affairs and Sports. They wanted us to help the NYKS learn to be a first level disaster responder, to have the basic skills. So we even taught them how to tie a knot of a rope and how to save a person the drowning person. All those skills, the medical first responder skills, how to do CPR, all these skills were taught. The same can be done for any student. And we have what is called a SSP, School Safety Program. Schools, in this case means schools and colleges. And we go around colleges and schools actually training and empowering students to be first level disaster responders. So we'll be happy to do it for any college or any school as requested. But just to underline this, the Kerala model, again, I just keep going back to that. I'm very proud of that. I do not belong to Kerala, but I belong to this country, and where Kerala is providing a model. They have brought it down to the students being actually taught disaster response skills, and the local trainers are there, and some teachers have been made trainers. So in that direction, I have made a move, and we have tied up with CBSE, and we are trying to tie up with UGC, so that a disaster response module is provided as part of the curriculum to all students across colleges. And then if practical training has to be given, those who want to volunteer for practical training can actually be given training and certified. So this is something that I am making a move for. But it is, as I said, I gave the example of Japan. Every Japanese student is self-aware, has learnt it because of the constant, hammering, let us say, through his school and college life about how to be a disaster-ready person. This is something that will have to happen in India, and I hope it happens sooner than later. Thank you.
Thank you, sir. Thank you for responding to this question. Participants, we have come to the end of day one session. There are two streams. One is Cisco WebEx, and some of you are attending it through YouTube. I'm sure that you already got the attendance sheets that is there as a link. So kindly click on that and mark your attendance for today's session. And tomorrow we will start the session exactly at 10 like today. And tomorrow we have interesting sessions on different aspects to disaster. So we request you to kindly come on time. And we also would like to let you know that the certificates and the feedback forms will be given only after the program, especially the feedback form. At the third day, we will be circulating it through a link. So kindly click on that and give the feedback on the third day. But every day there will be an attendance link that will be put up. So kindly make sure that you have put the attendance link and you click it and mark the attendance. Attendance link was already put up. We will again put it up now. Tasman, if you are here, can you kindly put the attendance link again? That will help every participant to click on that. And then, so tomorrow we will start the session at 10 o'clock. And then kindly, when you participate from tomorrow, most of you have cooperated so well in spite of some mishaps in between when we lost the links with the participants and as well as the presenters. Please mute yourself when you are in the app when you are attending this training program, and also please stop the video when you are attending the program. That will help us to proceed in a smoother way. The presentations, we have already requested the presenters whether we can share it with you. Once we get yes, we will definitely do that. Thank you. I think the attendance link has come already. Please use that attendance link.